I'm pleased to say good morning to Dr. Green and congratulations. Our next speaker is Warren Buckingham. Warren is the director of the Office of Global Health and HIV for the Peace Corps. He leads that agency's participation in the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the Obama administration's Global Health Initiative. As the Peace Corps designated deputy principal to the Office of Global AIDS Coordination, he also contributes to the interagency policy setting and direction of the HIV programs for PEPFAR. He was the first country coordinator named in any of the 15 regional PEPFAR-focused countries, and he served for 15 years as the coordinator for Kenya, and the first recipient of the PEPFAR Lifetime Achievement Award. At the request of 3 successive global AIDS coordinators, he also provided assistance to U.S. teams in India, Vietnam, Zambia, Mozambique, Namibia, Uganda, and Ethiopia. And in that, his role was primarily to see how he could improve interagency coordination and develop effective operational plans and long-term strategies. Currently, he's the designated PEPFAR Deputy Principal for Enhanced Coordination for Côte d'Ivoire, the Dominican Republic, Indonesia, Ethiopia, and Namibia. And I'm very pleased to ask him to speak as a respondent, having heard the 3 presentations, to give us some reflections on how this region can move forward in its attempts to ensure that its programs are sustainable, but also to expand it. Warren, please.
Good morning, everyone. I'm delighted to be here on behalf of my own agency, the Peace Corps, and its rich history of service across the Caribbean, but also on behalf of the interagency deputy principals in the Office of the Global AIDS Coordinator. What wasn't mentioned in that very generous introduction is that I've been working on AIDS first as a community volunteer starting in 1984, and then full-time professionally since 1986, so I also feel a bit like your designated dinosaur. I've also elected to be your designated respite from PowerPoint, so if they'd like to lift the house lights, that would be fine with me. It is Sunday morning, and some of us would customarily be in church, or perhaps after having a bit too much fun last night, some of us should be in church. So I thought I would offer a bit more of a reflection than a more traditional response to the compelling presentations that we've just heard. At the risk of making some of you nervous, and perhaps my fellow U.S. government officials very nervous, I thought I would start with a quote from Scripture. In the 29th chapter of Proverbs, verse 18 says, "When there is no vision, the people perish." We have had 30 years of the people perishing, although thankfully not so universally or so fast for the last decade. They have been perishing for many reasons, but that has always included, from my perspective, an absence of vision. Thankfully, we have heard some wonderful visions outlined this morning. We have, in our communities, in our nations, globally, had small visions of what needed to be done, and we have had occasional visionaries to keep us from losing all hope. But we have not, until very recently, had a big V vision of what was finally within our grasp. And this is finally possible because the accumulated impact of our efforts over these 30 years have intersected with scientific evidence of what works. And less than 2 weeks ago, I was privileged to be seated in the auditorium at the National Institutes of Health in Washington when Secretary of State Hillary Clinton pronounced that bold vision that is within our grasp: an AIDS-free generation. I must say that you had to be in the room to get the full impact of that pronouncement. But if you weren't able to be there, and if you haven't yet done it, I would encourage you to go to the state.gov website and try to get a sense of it, because the video, the streaming video of her speech is there. I was diagnosed in 1988 with AIDS, and I've been on ARVs continuously ever since, and thankfully have been kept alive by long-term participation in a clinical trial at NIH. But with all of that, I have to confess that I didn't expect to live long enough to hear those words pronounced and to hear them spoken so definitively by a world leader. But to be absolutely clear, neither she nor we should envision an AIDS-free generation because all of us who are infected die off. Instead, we can envision an AIDS-free generation because those of us who are HIV positive have been kept healthy. We can envision an HIV-free or an AIDS-free generation because, as we've heard, we can bring PMTCT programs to scale and make sure that no more babies are born with HIV. We can, together, achieve the rates of treatment coverage needed to hit the tipping point where community viral load drops so low that new infections are background noise. And as several of the presenters have said, we can, and in fact, in the current resource environment, we must focus our still significant funding and our abilities in prevention with laser-like prevention on what is evidence-based, on what we know will work, and being honest, as Amalia said, to stop doing what we should not be doing. How does all of that intersect with sustainability, the subject of this plenary? I was inspired by my friend Alan Whiteside's use of Wikipedia in his presentation to go there myself. I was a little depressed that the definition of sustainability, the one he put on the slide, starts with the capacity to endure. Because I don't know about you, but I've endured just about all of this epidemic that I can. I needed something more, and thankfully, thanks to the internet and Wikipedia, the something more is there. In between the passages Alan quoted, Wikipedia reminded me that sustainability, and this is a direct quote, sustainability encompasses the concept of union, an interdependent relationship and mutual responsible position with all living things on Earth. It is that view of sustainability, our shared responsibility toward one another, that will get us to an AIDS-free generation. Every one of us, whether we are bringing money or human capacity or righteous anger or cutting-edge science or critical analytical skills or the helping hands of a Peace Corps volunteer or just the experience of living with HIV, is essential, and we are all responsible to and for one another. I know that some people cynically think that the PEPFAR focus on country ownership of the last several years is about donor fatigue. But I want to assure you that I spend most of every Monday with my colleagues from the State Department, from USAID, from CDC, and from the Department of Defense. And while we are tired about some things, we are not fatigued about the future. What country ownership is about is ramping up the focus, which does make some people nervous in the current economic climate, the focus on HIV as a shared responsibility and the need, the imperative, to squeeze every possible efficiency out of the system. For example, as Secretary Clinton said in her speech, it is unacceptable for countries to reduce funding for health because of increased donor support for HIV. And we, activists, donors, and others, have a mutual responsibility to call them on it when it happens. Carl just outlined a bold approach to effectively expanding the fiscal space. In the original version of his presentation that I had, he concluded that, quote, the sustainability of the HIV/AIDS response in the region is, in a very real sense, within our hands. Note that he didn't say your hands or some amorphous their hands or my hands, but our hands. That means all of us. Because I was lucky enough to spend 7 of the last 10 years living on the African continent, and because I am always both inspired and daunted by the African on this panel, I want to introduce you to, or remind you of, a single word that sums up everything Wikipedia or anyone else might say about sustainability. That word is Ubuntu. Nelson Mandela and Desmond Tutu, among many others, frequently use this word to make clear how much we need one another, not out of any sense of dependency, but because we simply aren't all that we can be, our best selves, our best societies, our best nations, unless we are connected to one another. In this region of incredible beauty and diversity, of great wealth and great poverty, all of our epidemics are connected. And I know, in many ways, because of shorter and longer and wider and narrower air and sea bridges, the epidemics of the Caribbean are integrally connected to the epidemic in the United States. If we recognize, if we celebrate, if we respond to, and we capitalize on all of those connections, and each of us brings all that we can to the cause, I believe we will live to see that promised land of an AIDS-free generation. Ubuntu.
Thank you very much, Warren. And as we come to the end of this plenary session, I'm left with a couple reflections that I want to share with you. I think when we look at it and we start speaking about regionalism, we sometimes think of that in terms of governments and institutions. But what HIV/AIDS has done for us in this region is reminded us very clearly about who we are and want to be as a Caribbean people and what we stand for, and the type of people that we want to fashion. And that requires us to perhaps sometimes go back to our national anthems and understand the phrases that always speak to us being one people, together working, and being our brother's keeper. And the sustainability of this response is not going to be built on financial resources. It is going to be built on us. Enjoy the rest of the day. Thank you very much.